Hello, everyone, and welcome to Recovery Machine, Episode 6. Today, we're going to look at what happens in the very short period of time right after the initial change is made, right up until your initial assessment with a physician. So we're going to start with the first part. We'll be looking at disclosure and the events that follow disclosure within the first few days. Then we'll look at different strategies and maybe some risk factors that you'll want to think about in the months that follow. And we'll take a look at another couple important things that you'll definitely want to be informed about should you be in this position. So with that, I'll say hello to my co-host, Corey. How are you doing?
I'm great, Nathan. Happy New Year. Happy New Year to our audience. Thanks for checking back in with us.
Yeah, thanks for being here. It's much appreciated. Did you have a good little holiday session there?
I did. Yeah, I continue to be off work, but it was really nice. Nice time. Got snowed in a little bit, but had a great holiday. Yeah,
that's good to hear. I did as well. It was I didn't get a chance to get back last year because of the pandemic situation. So it was nice to be back in my hometown of Quesnel, and and now I'm ready to get more into this and get better at the whole podcasting.
Yeah, same.
All right. So we're going to look at what we're calling day zero. So day zero is what we mean by that is what happens when you decide that you're going to make a change. So for example, in my case, I had two different situations. One day zero where I decided to leave work and take a period of time off to try to kick OxyContin on my own. So that when I made that decision and left work, that would have been, we would consider that day zero there. And then the events that followed would be what we're looking at today. Similarly, day zero, the next time when I was managing the store and it became the employer basically figured out what was going on and called me in for a chat. And from there, at that time on would be starting with day zero and then what happened after that. And could you define yours, Corey?
Quite similar. I mean, for me, it was from the time that I was called by my employer and told not to come into work, and while I was awaiting everything else that followed. But it was the time where my access to hydromorphone stopped. And the time when it was, I think 2 or 3 days after that I stopped using marijuana. But so we're looking at just a couple of day period where all substance use stopped, and I was then waiting for the rest of the process to occur. Yeah.
Okay. So yeah, we're using this day zero as a marker because there's going to be a bunch of different scenarios that can occur after that event. So for instance, you decide that you don't like what's going on, whether it's maybe you have a drinking problem. It's only going on at home, not when you're at work, but you feel that it's starting to affect your work, or for whatever reason you want to make a change and you decide that you're going to take some personal time. So that's one scenario where there's no, you have complete autonomy. So you've decided how much time you're going to take off work, and you're going to tackle the problem not on your own, but you're probably going to look for help and support, but you're going to attack the problem without being forced into certain situations based on who knows what, as far as your employer or union or college or other authority or regulatory body is concerned. So that's the one scenario. And I'd like to point out that for me, when I did that the first time, I laugh at myself quite a bit because of the level of ignorance. It's not that my heart was in the right place and it was the right call to make. Obviously, I knew something had to happen. Unfortunately, I only gave myself a month before I went back to work, which is an absurdly short period of time. And a large underestimation of the time required to reset so that I would be stable enough to attempt something like that, especially without monitoring. I don't know that it could even be done like that in my situation. I don't think I'd want to try it without being monitored, but like I said, at the time I didn't know. So it might be, that's something that you'll definitely want to look at if you find yourself in that position, is how much time you're going to want to take off. And I don't know about you, Corey, but from what I see, most people underestimate that, or they look at it as a financial burden.
Yeah, definitely. And in your case, the financial part, when you're doing it on your own, when you don't have any kind of insurance that's supporting you one way or another, or benefits that kick in. If you're just doing it by taking your own time off, then there's the financial side. But even for those of us, including myself, where there is financial support from insurance and from the union and various aspects, I certainly underestimated the amount of time that it was going to take vastly, and was given the message that it wouldn't take that long as well, to be clear.
Oh, okay. Yeah.
So initially, I think I was under the impression that it might take 4 or 5 months from day zero to getting back to work.
Right. Yeah. I for whatever reason, I don't know. I do see lots of nurses who are kind of pointed in that direction, and it saddens me because I know that that's not going to happen. So I have to witness that person go through this period of thinking that they're going to be back at a certain point and then being dismayed when they find out that it's nowhere near that time, or in some instances they don't get their license back at all. And that is not something that, for whatever reason, I don't know if it's the union or the HR doesn't want to be the bearer of bad news, but I wish it's one thing that was changed, in that if an employer or a regulatory body had made the decision that they didn't want that person back, they should tell them, and they should tell them right away so they can, reorganize their life.
Yeah.
Instead of stringing them on. I've seen people. I had one client last year, a nurse that was involved in a really bizarre case, and she had been in limbo for 6 years. And
wow.
I'm like, that's a bizarre amount of time to be kind of hanging out and waiting to see what's happening, and she's being paid like a small portion of her regular pay, but it's a strange thing. So that's something that I wish was different.
Oh, definitely. 6 years is, that's highly unusual. But if you think about being off of work for 6 years under any circumstances, but let alone the effect that has on your mental health, and when it's a mental health condition that has contributed to you going off work, it makes it all the more challenging. So Nathan, I wanted to ask you this question. In my case, at least, my substance supply came from work, came from my employer. And so going off work, entering day zero, as we're calling it, meant that my supply was gone immediately. And that put me in a cold turkey circumstance where any withdrawal that would follow was on me to manage, unless I reached out and asked for some medical support, which is an option. So I wanted to ask you about your experience with that as well, about tapering. We're talking specifically about opiate use, but tapering certainly exists with alcohol use and other substances, versus cold turkey, versus some medical support options that are out there too. It's a big conversation, but if you could.
It is. And I do have a fair amount of different experience here, ranging from borderline experimental all the way to, what you call a textbook opiate taper. So yeah, we can definitely discuss that a little bit. The first time, like I said, was a situation where I decided to leave, and I had planned a taper. So if you're lucky enough to be in that situation, I had tried other methods that didn't work for me, such as I had tried methadone and found that it was really difficult to taper down at any speed. Like I figured it would have, from the dose I was on to where I wanted to get to, it would have taken me 2 years. Because that drug's half-life is so long, which is, that's what it's designed to do. It's designed to be taken once a day, and it's designed to take care of cravings and kind of provide that pharmaceutical support for what's missing. And it can be very effective. I've seen it work for people who are able to go slow. And that's the idea generally with all these opioid tapers. Myself especially, and almost every single person I run across who wants to try an opioid taper, they always want to go faster than they should. And I tell them it's go slow, go low. That's the tempo. So if you keep that in your head, there's no point if you actually want to do this and you want to make a change that's substantial, then it's going to take time. And if you rush it, you're way more likely to relapse. And if you relapse, you're right back to square one. So you just have to, it's one of those things where you really have to be patient. And it's something that an individual would have to feel out with their, depending on if you're doing this in a clandestine way, then by all means do go online and at least try to understand it. We're talking specifically about healthcare professionals here. So we're taking for granted that the person has some baseline understanding of the medication that they're on, but you're going to have to find a way to procure enough for a proper taper and then go from there. So that's one way. And that's what I did when I went, I tapered down to a lower point, and then just when I ran out. So I didn't have enough to do a long taper, and I didn't have the understanding or the patience. I wanted it to be over, and I wanted to get through it. And I didn't understand that it would have been better for me to go nice and slow and give my nervous system a chance to bounce back. Your case is interesting in that I haven't seen too many people like you who are able to have that kind of a substance intake while maintaining some abstinence from the substance as well, so that you were in a position where you weren't probably in full-blown withdrawal when your supply ended. Is that correct?
That is correct. I don't think I was. And because I was getting what I could from work and using it while I was at work, and then treating my days off and using my rationale of telling myself that I wasn't going to do that again the following week very often. I became quite used to that couple of days off without any opiate in my system. And so for that first couple of days of being off work permanently, or at day zero, I was already kind of used to that feeling, I think. And the anxiety I was feeling and all of the psychological turmoil I was having kind of coincided. And I think it was kind of enmeshed with any withdrawal that I did eventually have. But I think that happened probably, closer to a week to 2 weeks into it, because my body was so used to this cycle of like 3 or 4 shifts on, 4 or 5 days off, 3 or 4 shifts on, 4 or 5 days off. So then once I got to that point where I would have normally been back to work, then I think my body was probably saying, and I was feeling anxious and feeling stressed and all this stuff. It was like, hey, wait a second. What about this old friend that we've been leaning on for the last X amount of time, And I think, Nathan, we've talked about this before, that healthcare providers particularly are often very, very leery about accessing street drugs. And that's not commonly a route that they go to. And myself included, this is at the height of fentanyl. And I was, as much as my behavior was risk-taking behavior, that was something I was terrified of, that if I ever touched a street drug thinking it was an opiate, that it would be laced with fentanyl and I'd be dead. So I was always very mindful of that, and mindful of the fact that when I stopped, and it was nothing. So yeah.
Yeah, that's interesting. Having that line in the sand where, and it's it's another one of those things where you can see that there's some measure of control, even in the full extent of being addicted to the hardest drugs ever. You'll see people who draw a line in the sand. For example, they won't they won't use intravenously, or they won't or they draw the line at needles, or whatever there's a personal line there. Maybe it's they're only going to stay with a product that they know has not been tampered with, so pharmaceutical grade stuff only. Because I faced the same dilemma on my the second time I had to go through it, and I had learned a bunch of things by that time, and I think it gave me enough cushion so that I could hold the line. It's not that the thought didn't go through my head, like I mentioned. I mean, I definitely thought about it, but and it wasn't that I could care less whether I didn't want to die, but that was not really the concern. The concern was that if I went down there and did that, then I would forever be stuck, because there's something to be said about ease of access and trying to, when you're in that state, the best thing you can do is try to get some clarity, and you need abstinence to get clarity. So one thing that I did want to talk about there was some of the different things that can be done.
Yeah, please.
So if you might find yourself in the position that you're able to go to your GP, and if it is an opioid, and it's a high dose opioid, and you don't want to, you'd like to deal with it in a more, gentle fashion, then there's nothing wrong with trying methadone or Suboxone. And that's a personal decision. Being a pharmacist, I've seen a wide variety of people have success and have problems with those two. And for me, I was actually offered Suboxone in treatment, which I found was amazing because I was currently clean and they wanted to put me on Suboxone. I thought that was pretty interesting, but I didn't like the look of Suboxone just because I'd had so many patients who I basically never seen anybody come off it. So I didn't like that. And methadone didn't seem to work for me in that regard either, just because it took a long time. And either way, it wouldn't have mattered because I wasn't going to go in and complicate things by getting a script. But that being said, that might be the move for a lot of people, especially if you're in a situation where you think that you're going to have easier access and you want to try to, maybe you, for whatever reason, you've got a friend or whatever who has tons of access to street drugs or whatever. And if it comes down to that or taking a harm reduction medication, then I would definitely go harm reduction.
Oh my God. Yeah. I think it's a great message to say that it has to be about choice. And I think to give yourself a little bit of time to see how you're doing with either tapering or with cold turkey and abstinence is, I think it's fair, but also for me, to assess the resources that I had, the connections that I had, my family support, how safe did I feel? And I mean, at that point I had also simultaneously stopped drinking any alcohol, stopped any marijuana use, everything. So, and I felt confident in that. And I knew that what I needed most was clarity. And because even within a couple of days of clarity, it was helping me. But I chuckled a moment ago when you said that about Suboxone, because I was actually offered it very, very early on, within the first couple of days, by a physician that I had reached out to. But then I was offered it again during my first meeting with my addictions doctor, which occurred almost 2 months into abstinence, into sobriety. And I remember thinking at the time, I've done it. It's an ongoing thing, and I'm still working on it. But I've done that part where, why would I want to go on Suboxone now?
Yeah, that's.
I wouldn't have.
Yeah, it's, to me, it's crazy to ask, and I'm not sure. I'm sure there's some protocol somewhere that make it so that physicians are required to at least offer that. but there should be some consideration. I mean, I honestly, if I was in that position as a healthcare professional, I couldn't offer that to somebody who'd been away from opiates for that long. I couldn't do it in good conscience. I would feel terrible, unless unless they're displaying some kind of like instability that I thought their life was in danger. There's no way I would do that.
No. So Nathan, how gross did you feel? I think people would want to know that in both those day zeros that you experienced.
How gross. Well, the first time, so I took a week. Once I was out, I actually had a bunch left, and I got frustrated and threw it in a garbage container downtown van. And I always wonder if anyone was lucky enough or unlucky enough to find that, because if you're just scrounging through the garbage like a homeless person, all of a sudden you come across this big, container of goods. But anyway, I got frustrated with, so I didn't want to take the rest of the time, and I was impatient, so I threw it away, thus closing off any more comfort I could get from that. And so I started Acute Withdrawal, and it took about a week. So you're talking, so my daily dose ranged from 240 to 600 milligrams of oxycodone a day, right? So, and maybe I had that down to like I'd done a fast track down to maybe like 120. So maybe about there. So it was less, but my body was already upset with that. So when there was nothing else, I'd set up some pharmaceutical help. And one of the things I'd used that was helpful is something called the Thomas Method, or the Thomas recipe or protocol. I don't know if have you heard of that one, Corey?
I have, but tell us.
Okay, so it's basically it's a guy who I think he was an IV heroin user, and he'd been on and off multiple times, and he kind of became he became almost like an expert of how to ameliorate withdrawal symptoms. So or alleviate, sorry. So he was using usually some kind of sleep medication. So I didn't use benzodiazepines, but I used Zopiclone, because you're not going to sleep for a week without it. And obviously that's going to make it easier if you can sleep as much as possible. So I used Zopiclone in combination with Gravol to induce sleep. And it's important. I do want to say at this point that we're not endorsing or advertising or saying that this is something that you should do. We're just I'm describing what I did and the result of that. So, this is based on what I knew as a professional and my assessment of the risk versus benefit under the circumstances. So yeah, with that being said, Imodium is obviously something you're going to want to take. Otherwise the diarrhea is just going to be nonstop. Gravol helps with the nausea too. If you don't take that, you're going to be throwing up around the clock. L-tyrosine, there's other, some people use HTP. And what was the other one? Vitamin B6 also helps. Potassium and electrolytes are a big deal. So there's a good chance that you're at least partially dehydrated. So you should have some kind of like hydrolyte, have the hydrolyte going. Because you are going to do some throwing up, you're definitely going to have some diarrhea. But even going in, you're going to be dehydrated most likely because of your poor diet and just the way your digestive system's not been working. So some kind of hydrolyte or gastrolyte, whatever you can do. And then it was really hard for that week. The only thing for the first 3 days, I couldn't eat anything. And then on the last 4 days, I was able to have like a teaspoon of peanut butter, and I'd have like a little couple pieces of banana for potassium. And and then Clonidine was the other thing I used. And Clonidine is one of the problems with acute withdrawal that can be pretty scary, is how high your heart rate gets and your blood pressure. And what can happen is it plays into your anxiety, which is skyrocketing. And then you can basically get caught in this anxiety loop where you're just having panic attack after panic attack. And there's only so much of that a human can endure before they're going to, you're either going to be hospitalized or whatever the case, you're not going to be able to continue on your own volition. So, so you need something to deal with that. And I realized some of those things, like the Clonidine, the Zopiclone, are not over-the-counter medications. But I mean, this is what I had access to, so this is what I did. Now, that approach with the cold turkey got me back on my feet, so I could walk around and start working on staying awake longer and having some kind of structure to my day. So within a week, I was kind of, I started with walking 1 block, and then the next day I'd walk 2, etc. I think because there's such an imbalance, your homeostasis is so far out of whack that had I given myself appropriate time, even if I would have stretched it out to 3 months, I would have certainly had a better chance than 1 month. But 1 month is just absolutely too short for any kind of recovery from even, my addiction wasn't maybe as severe as a lot of people's, but it's still going to feel severe when you stop taking those drugs. So, and then the only other thing that I could think of that was helpful during that time was saunas, hot tubs, even warm bath, because you get to a point where you probably experience where you're shaking, your body's natural thermometer is way out of whack, and you're hot, cold. It doesn't matter what you do, you can't stop the bone aches, and it feels like you're freezing to death. So that's that part, and that's how I used got through the first bit. So I ended up getting myself back to work and thought that I was in good shape, which we know is not the way to do it. So we want to avoid that. And I would encourage people, if you are going to do that type of thing, please make sure, like I had my girlfriend at the time with me, and she was keeping an eye on me. Don't do something like this without somebody keeping an eye on you. And make sure you kind of study the method correctly so that you know what you're doing, because if you're not prepared and it starts, then you're not going to be able to do anything about it once that withdrawal kicks in. So for me, that I would call that first week acute withdrawal.
Yep.
And then after that, I would call post-acute withdrawal, which I didn't even know what that meant. And we're going to discuss that later in the podcast. But so that's the one thing. Did you use anything like that? Vitamins, anything to help you get through that first little part, Corey?
I didn't.
No?
I didn't use a thing. And I don't say that as a point of pride, but I really didn't. And in hindsight, the thing that stood out to me as you were talking was about sleep. Like my sleep for that first couple of weeks was just terrible. And the first couple of days was almost none. And I look back and I think, I think that was kind of my own stubbornness and my own not wanting anything else on my Pharmanet, and just thinking that I could do it. And I did do it, but I think, I put myself through a little bit of extra torture by not having any support to get to sleep and to make sure that I was well rested and stuff. I agree with what you said about the amount of time it takes to have normal digestion after that. I didn't sort of pursue any support for that either. And that just sort of resumed on its own over the course of the next couple of weeks. But it is rough. And, but looking back, like you had mentioned, our digestion was rough throughout our addiction. And, so you do have symptoms during withdrawal, but I was vomiting every day at work, every single day. And so it wasn't unusual, and was constipated. And so it wasn't unusual to be feeling unwell in a gastrointestinal sense anyway. So I just kind of rode that out, but you don't have to just ride it out. And And there is, I think you outlined it nicely, that there is no right or wrong way, that it's got to be kind of what works for you. And it's on each of us to, it forces you into a state of self-awareness anyway, and physiological awareness of what your body's doing at that time. And because if you are choosing to be abstinent, then not having any substance in your system makes you really, really kind of hyper aware initially. And
hyper aware, that'd be one way of putting it. Yeah. Hyper aware.
Yeah. So you gotta be honest with yourself, I think. And like you said about, anxiety, and that was certainly a problem for me too. And I was putting that more on, I put the anxiety more on the walls crashing in on me in that first couple of weeks. But I think if I'm looking back now, I think, oh no, those were withdrawal symptoms. And the walls were crashing on me. So it was happening simultaneously.
Yeah.
But a little bit of support would have probably reduced my risk in general and made me more comfortable, for sure.
Yeah, I think that's the big concern for me, is that I worry that there's a limit to what I can tolerate. For me, like that's it. It's basically, I guess the easiest way would be to imagine having a terrible nightmare, and you're in that nightmare, and there's no knowledge that you're dreaming. You fully believe what's going on. So you've got that level of kind of anxiety and fear response going on. But that's just the baseline. And then you're trying to ignore the fact that you've got yourself into this situation. So you're kind of beating yourself up while you're swimming around in this, just like a ocean of fear. Right. And, I don't know. I suspect there's a big difference in what people can tolerate there. I've seen people who seem to be able to get through acute in a way that just baffles me. Like I don't understand how they can walk through that kind of fire and come out the other side and shake it off. So there's obviously a wide variation there. But the other thing I did want to mention here is just to not make it all about opiates. I wanted to bring up the Sinclair Method and talk a little bit about what that was. And just for people who are trying to deal with drinking is an interesting problem to have if you're having trouble with alcohol, just because of its ubiquitous presence and its availability. You kind of gotta, I think you need to use some kind of strategy other than just, trying to willpower your way through it. That's not to say that it can't be done. Lots of people do either cut down their drinking to a level that they're is manageable, or choose to be abstinent from alcohol entirely, and they're able to go on, with support groups and stuff like that. But the Sinclair method is underutilized, I feel. And if you don't know what it is, it's a naltrexone. It's naltrexone is the base of it, but it's given in such a way so that you continue your drinking as you normally would. And so you're drinking, we're assuming you're drinking daily. So some doctors will tell you like an hour before your first drink of the day, or at the same time every day, you take this naltrexone. And what happens is after a couple of weeks, 3 weeks, we know that with alcohol, there's a wide variation in the dopamine response you get just on a genetic basis. It's got the widest variation of all drugs. So in other words, you can have somebody who responds with a 1 and whereas somebody else can respond with a 30. And if you looked at heroin, it would be more like 7 to 10. So some people, that's why, some people don't even understand why people drink. And there's other people who don't understand why other people aren't drinking all the time. It's because there's a wide variation in that dopamine response. So what this drug does is it tones down the reward that you get from that, from the alcohol. So over time, all of a sudden you're less inclined. It basically breaks the psychological link there between drinking and pleasure. And a lot of people find that their drinking either is drastically reduced, or some people quit entirely with very little effort just because of that, just by using naltrexone. So if that's a situation that you might find yourself in, do ask your doctor about that. You might have to ask a couple before they give it to you. I think because it's one of those situations where that drug it's been off patent for a long time, and I don't think you're going to get anybody doing the studies now to try to get it out there for that. But it is available, so I wanted to mention that.
Yeah, I was going to add, Nathan, that in my years of working as a nurse and all of the various types of withdrawal that I've seen, I think alcohol might be unmatched in the level of risk that it can put someone in if it's unmanaged, and like risk of seizure, risk of aspirating on vomit, risk of injury. It's really nasty, and it doesn't. I think I noticed in the recovery communities that I'm in that doesn't get its due credit of how difficult alcohol withdrawal really is.
Yeah, I mean, if you think about it from just a fatality point of view, you're far more likely to die from that, or alcohol we know it could kill you. Just withdrawals from it could kill you from seizures. So it's a different animal for sure. And I could tell you that I think about that often. I'm very grateful that I don't have that kind of relationship with alcohol. Yeah. I saw friends growing up who kind of gravitated towards alcohol in that way. And it seems that there's certain people that it almost, it changes who they are, and then once they turn into that person and they continue to drink, it becomes this situation where you can forecast the damage that's going to happen to their life well in advance. So it's a huge challenge. And I feel for people who are struggling with that. But again, it's something that people do beat. So there is hope.
For sure. No, for sure there is. So maybe we should move on to the other side of this experience. There's, the personal withdrawal side and managing your physical and mental health and stuff. We're going to get into that a little bit more too, but we've talked about in the last number of episodes about, whether or not you go to your employer, whether or not you report yourself, or if your employer comes to you, or if you go to your governing body or college, or whether you go to your unions for support. There are differences in all of those avenues. And so we wanted to talk a little bit about what you can expect. And it varies greatly depending on what your profession is within healthcare or within any kind of professional platform. But so for myself, for example, I was called by my employer and was told to stop coming into work, but I went through my union. So all of the actual support that I received in terms of what was next and how to seek resources, seeking appointments, seeking specialists, eventually treatment and stuff, that was put into motion by my union. I think it was the next day after I was called by my employer and told that I wasn't going to be coming in. I called the union, and I think I wrote them an email, and then I called them and said, here's what I've been doing. Here's what's up. And then they supported me from there.
Yeah. That's definitely one of the ways it goes, especially with nurses. You see that where, if possible, you could get into a situation where the employer and the union are working together without the college involved. And that is, if you can manage that is really spectacular. If you find yourself in that situation where it is a possibility that the union or your college can be kind of left out of the proceedings and the back to work and the treatment, it's definitely to your advantage to do that. One of the reasons why is often, and I see this a lot, where an individual is pressured to change their license to non-practicing. And almost everybody will at least have somebody along the line suggest that from your college.
Yep.
And that makes things, I think that makes things a little easier on their end as far as kind of containing you and keeping a thumb on you so that they can be, from a legal standpoint, entirely sure that they're comfortable with you going back to work. So I understand why they do that, but it's often they won't require it. So if you can, always choose to go to a suspended license in the beginning, and don't opt for going non-practicing, because it's way more expensive. It's way more work for you to try and get your license back down the line. So if that could be avoided, I mean, sometimes it won't be. I mean, they're gonna, if they feel they want you to hand over your license and that's it, then that's it. There's nothing you do about it. But, well, I shouldn't say there's nothing you do about it. You can get a lawyer, which is actually what I'd suggest you do about it. But that's a whole different ballgame. So there's that situation. And then the other situation would be like what happened to me the second time around, where my employer took what would be the standard approach and reported me to the college. And pharmacy, we don't have a union, so basically the college is going to be the one who, the employer is going to distance themselves, and I mean, they do have some obligation there as far as duty to accommodate is concerned and stuff. But mostly you're dealing with the college, and that's probably the hardest, in my experience. They're the most difficult entity to deal with. Although I have seen some crazy human resources departments, in your case especially, Corey, where there seems to be all sorts of different kind of ideas and motivations about what it means to be treated and recovered and all that kind of stuff. But yeah, generally that's kind of what's going to happen there. So obviously, if you're listening to this and you're in that spot where you're trying to decide what to do, even you're not going to think this, but I'm telling you, it's in your best interest, even from a financial point of view, to stop what you're doing and get serious about getting healthy. Because you might think that, you can keep, let's say you continue on for another couple of years, whatever. It's all you're doing is making it harder for yourself to dig out of the situation that you're in. You're at increased risk of death. Your absolute risk of death is way, way elevated. And I mean, there's a million different things that could happen. So I would encourage people to look into trying to get support, even if you have to pay out of pocket, that's fine. But doing that versus what some people do, where they go ask for help. Unfortunately, that is not a good plan, in my opinion. If you do that, you're going to be locked into the machine, and that's the end of your autonomy. That doesn't mean that you can't come out healthy the other end, but what it will mean is that you're going to be facing 3 to 5 years of monitoring, extensive costs that will, for me, 3 years of monitoring, 5 years of monitoring, you're looking at $50,000 in monitoring fees at least, and that's coming out of your pocket. So these are things that you should consider when making that kind of a decision. And
in the pharmacy case,
in the pharmacy case, yes.
Yeah.
And I hear this time and time again, and I can even talk to people when they're telling me that they're going to go in and kind of ask their union for help or their employer for help, or even give their license up, thinking that that's the right thing to do. And from an ethical standpoint, you bet it's the right thing to do, but it's not going to help you the way you think it's going to help you. So just be aware that there's ramifications that come with that path that that can be avoided if you figure out a way to do this with your own kind of setup.
Yeah, I mean, I think for me, it was too late. Like by the time I got the phone call from my employer, and I knew that they knew what was up with me, at that point, I didn't really have another option other than to go and seek some support. And it's within nursing, it's so common and prevalent is that, they have a whole department in the union for this type of thing, and are very, very used to it. And I found that to be reassuring. And so those conversations that I had with the union were actually easier for me and less nerve-wracking than the conversations I had with close family, because it was like I was talking to people who I was one in 10, let's say, nurses who have gone through it.
Right. Yeah. And that there's something to be said for that, for sure. I would also say that although I tried it on my own the first time, I failed to understand the significance of the problem. So there's that. I mean, how many people are going to really be able to assess themselves correctly? And on the second time, I couldn't do that anymore for whatever reason. I was at a loss. I was too far down the rabbit hole to figure a way out, and I just lacked the will anymore. I think you get to a point where you almost give up, and you don't think that, well, I didn't think it was possible. So it's like, okay, well, yeah, I don't care. Yeah. And whatever happened there at work where I had put myself in a situation where it was, that to continue would have been impossible. That, I guess that's kind of a safeguard that I put in there, but it it doesn't make it any easier as far as when the shitstorm starts, right? It's still a horrible thing. Yeah. But for whatever reason, I lacked the capacity at that time. And there will be people who find themselves in that situation where they either, who knows, chances are if you're in this position, you probably have other issues going on in your life, right? Where maybe your personal life is not what it used to be, or you've got some other issues that you're trying to kind of stave off with the drug use anyway. So, you're probably not in the best, even, drugs aside, you're probably not in the best frame of mind.
No, applying what we've talked about in the last few episodes about like how that addict brain speaks to us when we're actively using our substances, to try to be rational and make those decisions and navigate all this stuff with your employer and with seeking a way out of that. And without absence and without like removing yourself from the workplace, I don't know that I could have done it, because I think I would have lost that battle every single time. It's not to say that it can't be done, but with all of the other things you're up against, I think that that internal voice in my head was enough to keep me losing until I was cut off and had to press the reset button fully, right? Like, it's a matter of choice, and it's a matter of life circumstances, but that reset button is really, really vital. You have to kind of clear the dust away from it to access it, right?
Absolutely. Just to give people an example of what can happen if you do try to take that route. And I have a couple clients, Corey, you're aware of both of them, and they, the one is a nurse who was having, she had all the reasons in the world to come apart. She had a tragedy happen in her life, was concerned about the amount that she was drinking, and went in and asked for help from her employer. By the time she reached me, she was in a process of litigation with the college regarding a manager who was then trying to pin missing narcotics from 2 years ago on her for some reason. This is what can happen. And when you're, she had what she felt was a drinking problem that was concerning her. It had nothing. She was still performing excellently at work. There was no issue there. She just asked for help. And this is what happens. And now she's locked into a monitoring contract, and she's still trying to, she's finally got it cleared that the narcotics had nothing to do with her and stuff. But imagine having all that happen when you're trying to, you think that you're just going to go in there and somebody's going to help you, and they just railroad you.
Yeah.
And another example, the same situation, only it was they went in and talked to the individual went in and talked to a clinical counselor, addiction specialist, who then I don't think there was any kind of I don't think they had the authority to do this, other than she was in the same situation where she was concerned about her drinking, wasn't affecting her job, but that counselor decided to tell her employer, which is an ethical. I don't see how they could do that ethically and in good conscience. But anyway, that happened. So then she got stuck in this whole situation, and she's just about out the other end of it. But I mean, again, these are like 3 to 5 year terms, folks. They will change your life. So it's worth considering.
Yeah. So Nathan, maybe this leads us into the next question a little bit. Like, all of these, there's so much about this process that that includes a loss of control, like that is out of our hands. We do make the choice about how we navigate it, or who we disclose to, how we go about our disclosure, how much information we withhold. There are aspects of it that are within our control, but otherwise you're kind of a pinball bouncing around a bit with different bureaucracies. Like in some cases, 3 or 4 different bureaucracies, I think, in my case. So the only thing that we can be certain to control as best we can is ourselves and our own kind of mental health and our world. And I think that obviously we've gotten into this in the last number of episodes, that's difficult enough when you're in active addiction and when your mental health is struggling. But then you put yourself into a situation of high stress, of high exposure, of high disclosure, and it would be stressful for absolutely anybody, even if they didn't have a substance use issue, even if it was just a performance issue at work, say, and it had nothing to do with substance abuse. So how to kind of actually manage that, I think, is a really important discussion.
Yeah, definitely. Keeping in mind that from day 0, you're probably looking at a month, maybe 3 months, somewhere around there, before you see a physician for an initial independent medical evaluation.
That's right.
After which you will more than likely be sent away to a facility for probably 5 weeks or more, usually 5 weeks. So you're going to have, depending on, things have been different now with the state of the medical system and the strains that are on it right now. But usually, you from that day 0 on, you're going to have, let's say 3 months at least, where you're basically you're not at work. You're hopefully through acute withdrawal somehow, or you're on a maintenance medication for harm reduction, whatever the case may be. So let's assume you get to that point.
Yeah. And
now you're thinking about all the stresses of paying your bills now that you're off work. You're thinking about what people are talking about back at are people discussing you? You have all these feelings about what happened, and it's not a fun place to be mentally. I mean, I was anxious, depressed, despondent. It's tough. So I think for me, there were certain things that helped a lot to get me through that first little period and kind of keep me motivated and on track to complete the process. And we've talked about a few of these in groups and stuff, but they're definitely worth going over. So unfortunately, the way this process works, right when you're at your most vulnerable as far as stress is concerned, you're going to be hit with a bunch of different stressors that you didn't even know exist. So you find yourself in a position where all these little things start to matter. And by little things, I mean like daily structure. So trying to find a way to, when you go from working full time to no work, a lot of people have trouble with that adjustment anyway. And they find they start sleeping later. Maybe they're sleeping too much. Maybe they find that they're just, and this is without any kind of, not dealing with any kind of post-acute withdrawal symptoms or anything, just on a, person to person basis. It's usually the case. People have a little bit of trouble making that adjustment. So that's one thing that I think is important, is structure. And was that something that you were able to address in that period of time, Corey?
I think it's something I struggled with, that suddenly you got a lot of time on your hands.
Right.
And a lot of time to think, and you're kind of alone. I mean, we had supports around us, each of us, but ultimately you're on your own. And yeah, the reasons to get up, the reasons that kind of the factors that drive your week are changed and are eliminated. And your routine is kind of gone. I had my son with me for part of that time, for half of that time. And that in itself really you have to have you kind of have to keep those routines normal for a small child. And so that really helped me. And my routines worked around his routines. I think that was something that really kept me motivated, kept my life structured. I know that's kind of an unusual circumstance, and not everyone has that, but even if you don't, I think the principles of that, even if I removed my son physically from that, okay, like here's when I'm going to go to bed, here's when I eat dinner, here's when I go for a walk, here's when I've got some creative time, here's when I've got some play time. Not that I was playing, but I think those principles were actually kind of helpful to me, even if I didn't have my son with me, and they kind of guided me. But the amount of time that was on my hands, getting used to that initially was really, really rough, because your thoughts are so negative and complicated. And then on top of that, again, you have to maintain, and you have to, if you are going the route of abstinence, that's the key. And so nothing else can be a part of that routine that's gonna complicate that or mess it up,
Yeah, absolutely. I could definitely see how having a child would help with structure. I find that I don't have a child, but I have a dog, and that's not the same thing at all. But what it does do is she eats at a certain time, and she wants to go out in the morning at a certain time, and I get up at a certain time because that's when she gets up. And she has a certain desire to be in a structured kind of lifestyle, and because of that, it kind of helps me maintain structure. And structure was something that I really had trouble with, and I didn't even understand the importance of it at first. And one of the reasons why I think it helps is it plays into, the other things that you want to be thinking about. And that's, it's a good time to look at your health in general, as far as how's your sleep? Are you getting any sleep? What's your sleep hygiene like? Have you looked at these are probably things that you've ignored for a long time. What are you sleeping on? Is it is your bed 300 years old? What can you do to improve your just the basics of your sleep regimen, right? And having structure helps you look at that as a component of that structure. Same with diet. How many times are you eating a day? What are you eating? For me, in the beginning, I wasn't hard on myself with food. I let myself eat pretty much anything. And for somebody coming off opiates, you're looking for quick carbs all the time, because your brain is trying to use glucose instead of what it had before to alleviate pain. So I let myself do that for a little while, and then I started structuring my diet so that I was getting more protein, more healthy fats, and giving my nervous system the fuel it needed to heal as I went along. So those things kind of play into your structure. And then the other stuff that, like you were saying, a creative process is important. There was very few things early on for me that got me out of my head, and I needed to get out of my head. If I stayed in my head for too long, I felt that I was in significant danger. So between meditation, reading, writing, and that for me, writing was my creative outlet. But anything like I did do some. They had in the facility I went to, they had a ceramics thing where you could paint little statues and structures and stuff like that. And for whatever reason, that was like one of the few things that I actually enjoyed in that facility, because it narrows your focus. And when your focus is narrowed down, and it's not like it's taking a whole bunch of brain power to do, but there's a calming aspect to it. It's a Zen-like thing, like gardening. That's that same thing where you're using your hands, and it's not an overly difficult task, but it's enough to kind of there's something soothing about it. And making a space for that in the day was really important for me as well.
Did you keep your journals or any of the writing that you did?
I did. I still have it. And, I write fiction as a hobby, and the amount of introspection that they want you to do in treatment is, I understand why it's done, and I think there's real value in it. But I got to a point where I felt that I had looked under every stone and it becomes redundant. And once I reached that point, I think the journaling was at the end of its usefulness to me. And I had to turn to something else that brought me more kind of mental stimulation and joy. And that's creative writing. But the journaling and stuff, it's an interesting one, because some people, they can get, they have dream journals, they have daily journals, they get tremendous benefit, and there's something about that helps them maintain a structure. They like it a lot. I've never been the journaling guy. What I do have is I call it an amber list. It's a daily checklist that kind of basically, it's nothing complicated, but it gives me a few things I have to write down every day 3 things that I'm grateful for. I have to write down 3 things that made me happy that day, because there's evidence to suggest that doing that actually improves your outlook. And lo and behold, I believe that it does. So just a bunch of little things that are kind of healthy, and they don't take a lot of time, and it sort of keeps me on track throughout the day. And that's the way I handle the structure situation, as opposed to, sitting down at night and journaling and kind of going over the day, or having like a recovery journal based thing.
For sure. The way that the writing helped me was that even still, and I don't write now like I did in that first, say 3 or 4 months, but the most active time of day for my brain is that hour and a half or 2 hours before I go to sleep, especially when the lights are off and when I'm trying to fall asleep. And any worries or anxieties or stressors or just little thoughts that I've had throughout the day, suddenly they're really, really loud. And that's better now. I still have difficult days with that, but in that first couple of months, I did that as a kind of an active practice, where when I would get into bed and lights were off or just the lamp was on, kind of a thing, and that's when I would write. And it did help me to go to sleep, because when I look at I have the first journal that I did, and I ended up filling 2 full journals within the first couple of months. But I didn't start journaling immediately for the first couple of weeks, like maybe for the first 10 days. And I know how little I slept for that first 10 days. And I know how just brutally active my mind was. how negative my thinking was and stuff. And then I know that after that, my sleep did improve, and it kind of coincided with my use of journaling. And I don't think it was all about that, because I think it was also my body kind of getting used to being off opiates, and some of the stress was starting to ease about, my family knew, and I had support and stuff. But the writing really helped to tone down my thinking a little bit. And I also learned that it doesn't necessarily matter what you're writing, even if it is creative writing. I've recently gone back and looked at my first journal, and there's like 5 pages that I wrote about comparing myself to, at the time I had lots of feral rabbits in my neighborhood and in my yard. And I wrote like 5 pages on how similar I was to the feral rabbits that were in my yard. And, and just that kind of expression and release and kind of getting it out was really, really helpful. So I think just to put pen to paper, no matter what it is a helpful exercise. And I think the fact that it's turned into creative writing says that that continues to be the outlet, right? And a form of expression. And
yeah. And I should say that early on, I mean, it was just that. It was, and I totally agree with what you're saying there. There's something about when you get caught in a recurring thought pattern and you're ruminating on something, especially negative, it did help me to, even if it was in the middle of the night, to just stop, grab a notebook and just write it out and look at it. And structuring it on paper sometimes was enough to at least move that pattern away for a while. And you go on to another pattern or whatever, but hopefully it was less annoying. And, onward you would go. But that's, it's akin to, I don't know if you've ever had you've probably had recurring dreams before. Mm-hmm. And sometimes I've had a couple situations where some dreams, I don't know what to make of them, but they seem louder than others. You know what I mean? They're demanding a larger part of your attention for some reason. And there's, it might be that there's things in there that you should be addressing, or maybe there's some clues there as to what's going on in the background of your psyche that you're not consciously aware of. But I've found that when I take the time to get up and write those dreams out, that dream stops happening. Mm-hmm. So have you had that happen as well?
Yeah. Well, I've mentioned this before with my art. I've had that where the after I do a painting or a piece of clay about a recurring memory that has bugged me or caused me to lose sleep or given me anxiety, oftentimes that memory fades away a little bit, and I can come back to that memory, but it doesn't come back involuntarily. Mm-hmm. So often. So I think there is something to that. I was going to say that I think that there's such a common piece about recovery where it's about restoring the connection between our brain, our body, and our spirit. And so we establish routines, we get to know we improve our sleep hygiene, we get active and get walking or get exercising, we change our eating habits. Those are all like connections between what our brain is doing and telling us and how we feel physically, and then how we respond to how we feel physically. And the writing or any kind of creative process is kind of like, it's literally that. It's connecting your hands, which are putting it to paper or creating whatever the piece of art or writing or whatever it is, with what you're thinking. And it's like such a simple mind-body connection to make that takes some practice and some commitment to do it. But
yeah,
there's something to that.
There is something to it. It's weird. It's like a ghost that's looking for some sort of validation. Those thoughts they want to manifest in our conscious reality in some form. And once they are manifested, then it's like they settle down and go away. And I don't know why. I mean, obviously it's some sort of a catharsis, but it's a strange one, really, when you consider what's going on there psychologically. Like, why would that make a difference? Maybe it's that because our brains are constantly searching for patterns and constantly trying to reorder our environment, especially when we're confused. When you're really confused, or if you've been on any kind of psychogenic drug, you'll know what it's like as far as your brain can take a piece of information, and if it doesn't know what to do with it, it'll make it into something, whatever it thinks best fits that scenario. And maybe that's what it is the brain is kind of, it can't rectify what's going on with that thought process. So it wants to somehow give it enough order that it can kind of leave it alone. I don't know.
Yeah. And I think of all the things that all of the memories or pieces of grief that bug me and that were like problematic in my thinking. And once I nurtured them and like, held those memories and said, like, they did have an effect on me, and here's what it meant, and here's how I can come out the other side of it. It's like all of those painful things are begging to be acknowledged.
Yes, that's what it is. Yes, yeah. They want to be acknowledged. Yeah. And for some bizarre reason, that has a large impact on your psychological state. That's kind of what you talk about when you're processing emotions. A large part of the processing is you start with acknowledging that they're there. And I think that's why, repressed emotion is so dangerous, especially for, the emotions that are really making a lot of noise inside to get out and be acknowledged. When you suppress those, that energy goes somewhere it's not supposed to go.
That's right.
I really, I think that there's a lot more going on with the nervous system and our psychological state than we realize. And we'll probably, in the next little while, I think, because we're starting to acknowledge the fact that a lot of like chronic pain issues, and chronic fatigue, these things can be, they can actually be linked often to either repressed emotion or some kind of trauma or something that was not acknowledged and was pushed down and then kind of in some bizarre way festered into an actual physical symptom. I think that that's what's going on anyway.
I totally do too. And it's, for me, the evidence is in how these thoughts come back or how these memories come back. And I've had kind of interesting little experiments where situations that I was involved in at work, I've had opportunities to see them come back in the media, for example. Whereas before that would have, if I saw the story that I was involved in the media, like it either would have like kind of made me jump or gasp or like think like I could actually feel like a response. Mm-hmm. And that happened a couple of months ago and where a story that I knew very, very well and had a traumatic experience with came back and was in the news and my friends and family said to me, "Oh, like, what was that like to see that again or to think about that again?" I was like, and I'd done a bunch of writing on it and I'd done a bunch of art on it. And I was like, oh shit, I didn't even think about that. It didn't take me back to that. Because I think I had nurtured it. I had owned it and given it value and told my brain that, hey, this was an important thing that happened, and created some art about it and some writing about it. And then when it came back and I saw it again, I wasn't re-triggered in the same way.
Isn't that strange, eh?
Yeah.
To be able to see the results of processing a set of emotions and having a completely different response, to the point where the first response is a physical, like a gut punch type response. And then the second one is it doesn't even phase you.
Yeah.
Yeah.
Until someone reminds you and says, like, did that bug you? Oh, no, it didn't. It didn't that time. So,
yeah, that's fascinating. What else did I not mention in my little list here? I think we should, we're talking about this time where you're kind of in the first stage of limbo, you're waiting to talk to an addiction specialist, and you're trying to restructure your life. So we've talked about little things you can do to kind of keep yourself on track. There was something that I found really helpful the first time. I felt like I was kind of having was sort of coming unglued a little bit. And I sat there and I thought about what was going on, and I made the connection in my mind that the way that I felt and the way whatever my life was at that time, I realized that it was temporary. And that doesn't sound like a significant realization, but when you're under that level of duress, and for myself, it was easy to start to believe that there was no way out. And once I looked at that and I realized that it had to be temporary. It can't last forever. It's impossible. I mean, no feeling lasts forever. In given time, the feeling will change. And sure enough, it did. But I think that that's something that people could look at early on, and just every once in a while remind yourself that you're not always going to feel the way you feel right now, because it's, for one thing, your whole nervous system is out of whack. So, and we're going to talk about this in a bit, but with post-acute withdrawal, but you're also facing a whole bunch of different, like I said, there's stressors that you didn't even know exist, and all of a sudden you're facing them all. So that's something to consider. The other thing is the importance of really considering hiring a personal therapist of some sort. I know, Corey, you've had success with that. I do have a few different clients who went that route and found it tremendously helpful if they were able to find. It's not always easy to find a therapist that you click with, but in this part of the game where you're early on and you're very there's a lot going on. And I think just to have somebody who's at least familiar with the mind state that you're in could be pretty beneficial.
Oh yeah. Who doesn't love you, who doesn't have a personal connection to you, who's just impartial and can help you weed through it.
Yeah,
for sure.
Absolutely. Yeah.
And the only thing I would add to that is don't be afraid to walk out. I've had single appointments with counselors before where I've said, nope, not going back there. And I've had appointments with counselors where after a couple of sessions, I say, ooh, going to keep looking. And then find I've been very, very fortunate and trusted my gut with people, and found a wonderful one really, really early on in my process, and then found a new one much more recently. But there were ones in between where I just, no way.
Yeah.
So don't be afraid to you're the boss, kind of, right?
Yeah, that's a really important point. And what you said about trusting your gut there, I think is really important. You will know when you find somebody that you're connecting with.
Yeah.
And if it doesn't feel like that's happening, then by all means, keep searching. And the therapists are aware of that too. It's not like they're going to be insulted. They know that, not every person who walks in is going to be a client that they can help. So,
yeah.
So that's, and then the only other thing that is probably worth investigating if you have the time, the motivation, and the energy is looking into cognitive behavioral therapy. Just the basics, I think, of CBT are helpful to go over. I mean, most people, I think, are familiar with at least some of the negative thought patterns that people are susceptible to. But I found it really helpful to actually get those basics on paper and then go through them and look at them and, okay, what part of this is affecting me? And, I think you're similar in this way, Corey, but the amount of different techniques my mind was using to generate negative thoughts was staggering in the beginning. Yeah. I mean, they're coming at me from angles I didn't know existed, and being able to look at them, say, oh, okay. And then challenging those thoughts based on those patterns. Once you recognize the patterns, then it makes it easier to question the validity of the thought pattern that you're having. And that's kind of the basis of it. So it's it helped me.
Me too. And we both have experience with the smart recovery model, which is a great alternative to AA if AA isn't up your alley. And that's heavily cognitive behavioral therapy based. And there's lots and lots of tools that you learn on a weekly basis by attending smart recovery meetings. So just a little shout out there.
Absolutely. So with that, we come to our last point here, which we wanted to talk about, which was, first of all, we wanted to give a clear definition of post-acute withdrawal, because for some reason it doesn't get the attention it should. No. And I suspect maybe it's because it's not as like everybody knows what acute withdrawal from opiates looks like just from movies and stuff, right? So you kind of have at least a somewhat of an understanding as to what they look like and what the process is going to include. But post-acute, I hadn't even heard that term before I encountered it. Were you aware of it at all going in, Corey?
You were the first person who told me the term, and that was 3 or 4 months into recovery. So I had not heard it. No.
Okay.
No.
Yeah, and it's funny because it's a well-known, well-documented. Maybe the problem with it is because it's so hard to treat and it's structurally elusive, and that it can have a presentation pattern that's very different depending on the individual and other factors. But generally, the way it works, and keep in mind that this is for any kind of substance. Alcohol has post-acute withdrawal stages as well. Cocaine, stimulants, benzos, all of it. So what happens is you go through the acute withdrawal phase where your body is basically having a freak out, trying to maintain or re-achieve homeostasis. And once you get to a point where that no longer becomes a real symptomatic thing, as far as you're not actively throwing up, and all of a sudden you're maybe able to sleep a little bit and you start to feel a little bit more normal. There's a stage that begins. So after say you quit and you were abstinent for 2 weeks, you go through all those acute withdrawal symptoms, and then you get to this point where those kind of subside and you're left with a feeling of what you think that you should start to feel normal again. That's what most people think. And what happens is you feel there's a few common symptoms that most people feel for. It can be an extended period of time, depending on your use. It could be, it could be a month. It could be 2 years. It depends on how heavily your drug of choice was abused. Maybe it was a polysubstance situation where you got a few different drugs being used. The strength of the drug. I mean, if it's methamphetamines or something like that, and you've been using them for a long, long time, you're probably looking at a significant period of recovery where you're going to be facing post-acute withdrawal symptoms. And also it's individual based. So you could have 2 people, same size, same shape, different genetics. And for some reason they do everything the same, but the one has post-acute withdrawal symptoms or pause for 2 months, and the other one has symptoms for a year. We don't know why that is. Science has not been able to elucidate what's going on there, but there's a genetic variation in the elasticity of your nervous system, I guess you could say. So common symptoms are just a general depression, irritability, anhedonia, which is basically you feel like nothing brings you pleasure. So whatever, you might have enjoyed some type of food, now it tastes bland. Sex, it doesn't do anything for you. That can be another factor. Actually, your libido tends to drop off, at least for a little bit. Insomnia is common. So you'll start to sleep again, but your sleep will be generally poor quality. You won't sleep as deeply or as soundly, and you wake up feeling not as refreshed. And brain fog is common. That's That's something for some people that can last a long time. And the really weird thing about pause is that it can come and go in waves. So, like for instance, I had an experience where I was probably 2 months out, and I had a day where I was feeling good, and I couldn't believe it. I was driving along, it was sunny out, and so there was a song that came on, and I was like, huh. And it'd been so long that I enjoyed music, and I actually heard the music and I enjoyed it, and I put a smile on my face, and I thought, oh man, I'm getting better, and I had kind of a good day there, and I started to think maybe there was some hope. And then the next day I just got hammered with like the worst pause symptoms I'd encountered yet. So there's some kind of a process that has to go on there where this is fairly common, where they'll have a good stretch and then they'll have a little bit of a rough patch and back and forth. And then eventually that kind of roller coaster evens out. And at some point you are back to basically your normal baseline, which most people will get to unless you've really had a lot of indirect health, like if if your nutrition's been poor, maybe you've been living on the street doing heavy drugs for a long time, really beat yourself up, then you're probably going to have symptoms that might not go away. But for most people, if you're taking care of yourself and at least reasonable throughout your addiction, as far as taking care of eating and sleeping and stuff, you're probably going to come out and eventually feel somewhat recovered, and then fully recovered. So I think it's important for people to understand that that's a real thing, and that if it happens, it happens, and you shouldn't be surprised by it, but it doesn't have to happen. Some people, they get through acute and they have very few, I call these types of I call these people tanks. For whatever reason, it doesn't matter what they do. They get through acute and they're just back to normal. And it really bothers me because I get super jealous, but it's just, again, it's a human variation thing. So
did it coincide with urges and cravings for you?
Yeah, of course. I think one of the most dangerous things about pause when it's not brought to somebody's attention is you can think that you're going crazy, and you might get it in your head that this is never going to end, right? Because you get confused. Like, it's been 6 months. Why am I still depressed? Why do I feel like this at this point? And then you can get it in your head that you're actually a damaged person who the only way for you is, that's when that little voice is going to start up, right? It's going to be telling you that you need drugs. If you don't get those drugs back in your system, you're always going to feel like this.
Yeah.
And that's a real good point of entry for relapse.
The thing that I was going to say, two things. The thing that I noticed for myself most obviously has been little memory things that wouldn't have been there before, where I didn't have, and it's not always the case, but I would say intermittently over the last year, where I will, have little glitches in my memory, or it takes me a little bit longer to pull a memory back, or a word back, or like something that would otherwise have been right there at the front of my brain. And just being patient with that, and knowing that is potentially a symptom of that, has allowed me to go easier on myself, I think, than to say, like, why am I not remembering this word or the name of this book or whatever that may be, Yeah,
it's interesting that you bring that up, because I got really confused by that at first too, and I realized that there were two different processes going on. When was the last time you took this kind of a break from your profession?
Never.
Yeah. So it's not just that your nervous system is healing. You're also not being challenged like you were being challenged, and our brain does get rusty. And I thought that was what was going on with me as well. And then when I went back to work, it took me about 2 weeks, And all of a sudden I was sitting at home and I was like, oh, my brain was just out of shape.
Yeah.
And I've since that because I do my career style and path is always, I'm doing something for a little bit and then I'm over here doing another thing. And I try to avoid that hair straight back, kind of pace, but I do get to it sometimes. And when I'm there at first, I'm like struggling. And then all of a sudden you get it's kind of like your muscle memory kicks back in and then you notice it. Oh, okay. Yeah, I'm not, maybe it's not so much that, and maybe it's just a little bit of work rust,
Yeah. The thing that's so interesting about it to me is for myself, is that the symptoms are so similar to some of my personality traits that existed for most of my adult life, all of my adult life. That leaning towards depression or leaning towards like a bit of anxiety, overthinking, things that we've talked about, like neuroses, perfectionism, all that stuff. And then, or mood, like a moodiness, where I can wake up and just have a sort of a chip on my shoulder or an edge to me that day, where the general public or a social situation kind of makes me feel on edge. And that kind of always existed in my adult life. But I have more pronounced days now where I notice that it can be kind of inexplicable, where I'm not necessarily can't identify a reason, but might just kind of feel that given away, if that makes any sense.
Oh, it makes complete sense. I think we're both similar that way, right? We tend towards, we're probably a little higher on the neurotic scale. We're, we both have to fight the darkness more than maybe the average person, that kind of thing. And like just that, what I've noticed is even just that neurotic component plays a big role in there seems to be a correlation between that and how long somebody stays in pause. And like what I mentioned, the people who I call tanks, they are not like that.
No,
no, they're optimists. They've never had an issue with they're not neurotic in the least. They tend to be very even keel. And I'm sure that this has something to do with their ability to bounce back faster.
For sure.
Because what you're saying makes perfect sense. I mean, these issues like irritability, mood swings, fatigue, insomnia, well, maybe not the insomnia for me, but definitely like anhedonia, fatigue. I mean, those were things that I faced long before I faced any kind of a drug problem.
Yes.
I mean, it's just my nature. I'm prone to that to start with. So, of course, it's going to make it worse, which is why drugs work so good in the first place.
Right.
Yeah. So that does kind of lead us into what we wanted to discuss with comorbid conditions, where this period of time, this day zero forward to 3 months, is a good time to start to think about, start a little bit of introspection towards, what was the drug doing to help you as far as your mood was concerned? Was it strictly that your job was really stressful and it was giving you relief from that? Was it that, if you think back, maybe is there a condition that you were trying to treat, such as depression or something that maybe you're already on an antidepressant for, and the drugs helped with that? I know for me, I've talked about anxiety as a kind of omnipresent situation that wanes and sometimes I barely notice it. Sometimes it's pretty obvious. Depression, kind of the same thing. I've learned a lot of tools to be able to deal with those, the negative thoughts and stuff like that. But definitely there was an issue with that going on long before I had any substance abuse issues. So I think if people don't at least consider that possibility that there's something else going on there, then it could be that they get out of treatment, they find that they're abstinent, their life has become manageable again, and they still feel like shit. because the drug was a tool you were using to cover up a problem that still hasn't been addressed. Was that, I think that was probably a little bit of the case with you as well, right?
Oh yeah, absolutely. Absolutely was. And I think the thing I've learned, and I can tie this together, both the pre-existing, episodes of depression or anxiety and moodiness, and then feeling that, the waves of pause, that I've learned the value of some of the coping mechanisms, like what exercise has done for me this year, that like when you're feeling that stress, there is something that you can do about it. And like that a physical release is really, really helpful. And I've had days where I felt like exercising, and I've had a personal trainer this year, and where there's no resistance there. But the really interesting days have been the days where I've had stress or had some anxiety or didn't sleep well that night because of some insomnia and a racing mind and stuff. And it's like, now try that exercise and see what it does. And invariably I end up sleeping better, feel like a physical release of the tension. And then you get kind of like that dopamine kick or that endorphin rush from the exercise. And that's not been the only thing that's been helpful, but that's a kind of an example where, like, how to push through that state that already existed. And when I reflect back on myself in my, like, earlier in my adulthood, like in my early 20s, when my mental health and physical health was at its best, I was meditating. I was attending meditation classes. I was exercising sometimes twice a day, always once a day. And I had like a very well-rounded, balanced life. And the depression and anxiety and all those other symptoms were probably there, kind of low and rumbling, but they were much more manageable. And as the balance tipped off for various reasons, for life circumstances, because of my job, because of scheduling, et cetera, lots of stressors. Those comorbid conditions like anxiety, like some depression, negative thinking, crept up higher and became less and less able to manage,
Yeah, absolutely. I think exercise is probably the cheapest, most effective therapeutic tool that we have at our disposal. I mean,
sure.
It asks so little in comparison to what it gives, and it's always there. If you're creative, you can exercise pretty much anywhere. The impact is immediate and it's pretty reliable. So yeah, I mean, all those types of things. And yeah, you're right. I mean, maybe, this ties into more acute conditions like, post-traumatic stress, for example. Maybe you're off work for post-traumatic stress, or maybe you're off work because you had a post-traumatic stress incident and you dealt with it by using a substance, which is pretty common. So that's a real clear example of where, you do need to get your drug use under control. Like that's going to have to be taken care of first. But that's really kind of just the beginning of what needs to be done to make the adjustments so that you can live a more balanced life again, right? So, and any kind of, like I've said before, I don't believe that every drug problem is a source of trauma. But there are people who have a lot of reasons to use drugs. And if you look at their past, and I think everybody should be able to make their own decisions regarding, if you've got somebody who's got a horrible past and they're finding that they're able to function better when they've got some kind of opiate in their system, then I don't judge that person one iota. I think, if I don't have those kind of traumas, and if that's what it takes for that person to be able to live a normal life and they're relatively happy with that, then there's no reason in my mind to force them to become abstinent. So it's kind of it's a matter of autonomy and personal choice at that point, I think. Would you agree with that?
Oh yeah, absolutely. Mm-hmm. And I think that comes down to what we've talked about asking yourself, is this working for me? Right. Like, and I look at connecting it to the conversation we're having here about our state of health and mental health, even before addiction and during and after. Is this working for me? And in recovery and in sobriety, is this, the state of anxiety and like negative thinking, if I wake up and I'm feeling anxious and dark, is this state working for me? And I'm committed to the fact that I'm not going to use a substance to remedy that, but it's like, okay, it's not working. So what can I do about that?
Yeah.
And it's not always that easy. And clicking out of that mindset is the key. Like for me, that is such a huge piece of the puzzle, is clicking out of that mindset or acknowledging that mindset that I'm in. Because without that awareness or without that insight, I just sort of stay put in that, and then other things fall by the wayside, I think. But if it is such that for a given time for someone, if a substance or if any kind of a behavior is working for them, it has to be their choice, and making that choice to start the process of recovery. That's where we kind of regain control of our lives, I think. Right. And yeah.
Yeah. More to that point, I guess, or an example that comes to mind is a person that I had a girl that she must have been maybe late 20s, something like that. She was on the same ward as me in the treatment center. And the first time I ever heard of her or saw her anything, she was running down the hallway screaming, and she ran out of the facility and they found her. She had made it partway into the river and was standing there, in her underwear, frozen. And I was like, holy, what is going on here? And she had completely dissociated at that point. So they had to send a little team out there to kind of like pick her up and bring her back in. And the next day we were on a walk, and I just started, every day I would start talking to her a little bit. And because I wanted to find out was there a mental illness that was called, like, what was she so afraid of, basically? And in time, she told me that she's an immigrant from, she was involved in the Serbian-Bosnian War. And I don't know if you know much about that one, but rape was weaponized heavily in that war, especially on the Serbian side. And she was Bosnian, and she was, I think she was 7 years old, and they were on a bus, and the war had just started, and the bus got stopped by a bunch of guys with machine guns, and they took her and a few other younger girls off the bus. And then they told her mom and everybody to get back on the bus, and they drove away. And that was the last time she saw her mom. From that point until she was 13, she was used as a pleasure girl in war camps for the Serbian army. So she would be chained to a post naked throughout the day. That was it. She didn't move anywhere. She went to the bathroom there. She did everything there. And guys would just come along randomly and kind of use her. And then when they got tired of her, they would trade her with another girl from another camp. So she would get passed around. And for years, that's all she did, was get passed around from these different guys, until eventually the UN came in there, and there was a bunch of missions to save, civilians from both sides. But she ended up getting saved by a UN convoy. And Canada took some of those refugees in. So she ended up in Canada, and that's how her life started. Now, what happened from then on is not really surprising, but she ended up heavily. She was the highest dose I'd ever seen for oxycodone orally. She was taking 80 milligram OxyContin a day, which, I mean, she was maybe 120 pounds, and 5 grams of cocaine per day. So that was her just getting by dose, right? And so I'm listening to this, and I'm watching these guys, these counselors and stuff, and they're trying to tell her about how she needs to, eventually get off. They had her stabilized on, a whack load of methadone and other stuff, I'm sure. But when I look at somebody like that, and I see, I don't see abstinence, at least I don't see it as an immediate goal for someone like that. I think there's a level of trauma that, I mean, you could put that person in therapy for the rest of their life. It's not going to matter. Like those dissociation events she was having where she would just panic and run, she's not even there. That's just her body, to even get that under control, she would probably need some kind of pharmaceuticals, right? So it is something to consider, and it's easy for us because we are blessed enough to live in a place where, hopefully you don't run into something like that. But not always the case. And there's different levels of trauma. I mean, there's people, Vancouver East Side. I don't know if the right thing for them is to get them onto a zero dose anything, like probably they're never going to be off pharmaceutical drugs anyway. So I think the mission should be, let's get them comfortable, let's get them stable. And that's sort of what you're trying to do. What that's what I was trying to do with myself in the beginning. Right.
Yeah.
The mistake I made the first time was based on, I got to get this drug out of my system as soon as possible so that I can get back to work. That's nonsense, right? That's, work is very low on the priority list when you're talking about that kind of an addiction. And yeah.
I think giving ourselves the time as professionals in the context that we're talking about here is a huge foundational piece of it. And it is contrary to what the message that we have all been given is, right? So
absolutely. Yeah.
And it's not accepting that it will take time and that it will be a bumpy road in many, many forms, is to set ourselves up for disappointment, for frustration, for anxiety, for risk of relapse, and just a huge toll on our mental health. So I think, we're talking about that first stage from day zero and on. In that first stage, I think the message we want to hit home is to be patient with yourself in the journey and be patient with how long the process is going to take. And that's partly due to the bureaucracy, but whatever, it's going to take long, and being okay with that will be helpful.
Yeah. And that part about, I talk lots about being your best friend. You have to be your own best friend, and you probably won't feel like being your best friend. You're probably pissed off at yourself in that period of time. You're lots of negative, like, why did I do this? What's wrong with me? How come everyone else is able to do this? I can't. What's, really that kind of talk. But the only way to make progress is you're going to have to learn to advocate for yourself throughout the process. That's one thing you're going to find out. So if you're not your best friend, then you're going to have much more trouble than if you're looking out for yourself. So that's a mindset that you're going to have to cultivate, or at least try to work on cultivating early. And the quicker you can kind of be on your own team, I think the better chance you have of not only getting through the entire process, but of also being able to absorb information that's useful from whatever treatment plan they assign you, but also being able to let the stuff that doesn't pertain to you go, and don't get tied up in that, because that's another mistake people can make, especially in treatment, right? So, but yeah, we'll talk about that next time. I think what we'll do is, for the next episode, we'll probably maybe look at the independent medical evaluation and then forward on to treatment.
Yeah,
that might work, eh?
I think so. Yeah.
So yeah, then our goal here is to give you, we want to give you a really nice picture of what is going to happen. So we're trying to lay this out for you so that you're prepared, and you can think about your options a little bit beforehand, because lots of times when most people go through this, it's like you're really getting smacked around. It feels like you're getting blindsided on a weekly basis, because nothing is ever explained to you in total. They always hold something back, and then you get to the next hurdle and you think you're through, and then bang, gut punch. By the way, this is happening. So we're going to try to lay it out as nicely as we can. And please, if you do have questions, this will be on YouTube, of course. So you can ask questions in the comments, or email us at us@recoverymachine.org. And we're happy to answer any questions.
Yeah, for sure. I think hopefully we've said a couple of things that will be helpful and give people some ways to cope and manage navigating the system, right? And for listeners who haven't been through it, or are just listening because they care and are interested, I hope that it at least broadens everyone's understanding of what really happens out there, right?
Absolutely.
Yeah.
All right, Corey, that's good stuff. I think we'll leave it there. Call that episode 6, and see you next time.
Yeah. See you soon, everybody. Thank you.